Hello, and welcome to Working with Behavior Challenges. My name is Lorraine Henriksen. I am the Director of Programs and Public Policy for the Alzheimer's Association. My colleague and I will be talking to you today about working with the behavioral challenges that are involved in being a caregiver for persons with dementia. Our overall goal is to help us all to obtain a better understanding of successful ways to work with persons with dementia, and most of all to understand what behavioral changes are caused by dementia and exactly what the word dementia means when we're talking about persons for whom we are caring. We want to learn how to be a more successful caregiver. And in order to be a more successful caregiver, we have to focus on creating a successful environment and developing successful strategies to work with those with dementia. Dementia, first of all, must be understood as a disease. In fact, even beyond a disease, dementia is really a name for a grouping of diseases and symptoms, all of which are characterized by a failure in the brain. It's very, very important to remember this in working with those individuals, that this is a disease. This behavior which we see is not purposeful. Many times it is the result of failure in the brain, and we will talk a little bit about what that entails and what the brain of the person with Alzheimer's actually looks like and what various areas of the brain are involved. One of the things you will note in working with persons with dementia is that they are often confused and often wondering about what you are trying to convey to them. Oftentimes people with dementia are saying to themselves, "What is this person telling me to do?" Dementia causes a progressive loss of memory, judgment, impulse control, abstract thinking, and language abilities. Because of that, you will see failures of all of these functionings, and you will often see these failures occurring together or separately, and you will see them occurring at various times of the day and in various situations. Flexibility is always the key in working with patients with dementia. Different areas of the brain are responsible for the behaviors that are observed in patients with dementia. As the disease becomes more prevalent, different areas of the brain are affected, and that will cause the behaviors that we will be talking about. Alzheimer's as a disease is first apparent in the hippocampus, which is the center of the brain. And because of this, one of the first things we notice in persons when they begin to develop a dementia is a loss of short-term memory. As the disease attacks the hippocampus, it attacks the short-term memory, and eventually new memories become impossible to make. And for persons with dementia, learning is a thing of the past. When we talk about behavior, it then becomes obvious that we are the ones who have to do the learning. Persons with dementia are no longer capable of learning not only new subjects, but many times they're not capable of recalling something that they actually were capable of telling you about a half an hour ago or even 10 minutes ago. Without knowing what has happened in their past and without even being aware of what is likely to happen during the course of the day, they lose the ability to judge things like time and place. And they also lose actually their perception of where they are in relation to time and place. They don't understand what's going on around them. And all of these symptoms are the result of brain failure, damage to the cells of the brain. When you look at a PET scan of an Alzheimer's brain, it becomes obvious that cell damage has actually resulted in huge areas of the brain no longer being active. And so when we're looking at a scan and we see dark areas of the brain, this is the result of the actual death of brain cells, of neurons within the brain. Dementia has many symptoms. One of the things we first notice is a change in behavior, and we also see a change in personality with persons with dementia. The important thing to remember about this behavior is it's not random. It is that it has no malicious intent. As caregivers, often we will take this behavior personally because we are human and our feelings can be hurt, and because we may have a limit to our patience, which we all do. Sometimes the behavior of the patients will be very difficult to manage and may appear spiteful or hurtful. This is the only form of behavior many of our patients will have. The only way they have to communicate with us is through their behavior. Here are some of the common behaviors that you will encounter. Wandering and pacing at various times of the day and various environments is extremely common in patients with dementia. Calling out and actually repeating either the same phrase or the same word over and over again is also a symptom of dementia. Many persons with dementia find the bathing and grooming experience to be incredibly difficult. They will often resist every attempt to bathe or to carry out personal care. The most overwhelming emotion I have seen in persons with dementia is that of fear. And fear is a direct result of being incredibly confused and incredibly poorly informed about the universe around them. They try to use everything in their environment as a cue, but as you can imagine, many times their perceptions are difficult and their perceptions are inaccurate. This leads to a lot of anxiety, leads to a lot of anger and frustration and fear. Many times persons with dementia will exhibit paranoia. They are scared and they may attribute motives and imagine things that are actually not happening. They suffer from both visual and auditory hallucinations. Persons with dementia do actually see things which are not there. They actually hear things that you cannot hear. They do also have delusions. In other words, they think things are occurring. They think that people may be stealing their money. They think that someone may be attempting to hurt them. They may see and feel that other people are in a room with them, even though you and I cannot see them. This behavior or these feelings often lead to losing and hiding things, which is another disturbing aspect of the dementia behavior. So how do we approach persons with dementia? The most important thing we need to remember here is that we have to be in charge, and we are the people who have to change, because persons with dementia are not capable of changing their behavior. If they were, and if they had the choice, certainly they would not be behaving in some of the ways which they exhibit. So we change our attitude from a negative to a positive. We have to learn to try to see things as they see them, so we have to change our own perceptions. We have to sometimes be willing to change our social roles in our approach to these individuals. And we also have to remember that if we can anticipate these behaviors and try to avert some of them, that we will have a more successful relationship with the patients, with the persons with dementia, and that they will be much more relaxed and much more trusting of us. There are also various mental and physical causes for some of the symptoms that we see in persons with dementia. A very, very common situation is a reaction to medication. And I actually should say, instead of medication, I should say medications in the plural. My experience in working with the elderly over the years has told me that it is very common for older patients to be taking many medications for various conditions, and that they often are taking these medications improperly, or their usage of the medication has built up a physical reaction which needs to be monitored, and the medication dosage or even the administration may need to be changed. Infections are very common, and unlike you and I, a person with dementia has no way to communicate the fact that they are suffering from an infection. We have to be alert to these signs and take appropriate actions. Acute illness can occur in a patient with dementia, but they may not be either able or willing to let us know that they are in extreme pain or that they're experiencing other physical symptoms. So we have to be the ones to discover and track the patient's behavior, which is a clue to their feelings. Dehydration is also very common because people with dementia do forget to eat and drink. They are not aware many times of where the drinking fountain or the cafeteria or any other place may be where they can get either nourishment or refreshments, they will be reluctant to ask. They may even, in the mid to later stages of the diseases, actually need help with drinking and eating, and you will need to be aware of that. They do experience pain, as we all do. Arthritis is very common in many older patients. Headaches are very common with everyone, and yet a person with dementia may never think to say they have a headache. You may have to notice that they're sitting and holding their head or frowning or grimacing, and that would be a sign that perhaps they do have a headache. Depression is a very, very common phenomenon with the aging in general, with persons with dementia in particular. It often accompanies a dementia. It is very obvious that people in the early to middle stages of a dementia may very well feel depressed and may suffer from true clinical depression. In the mid to late stages of the disease, it may not appear that they are exhibiting symptoms of depression, but it can still be part of their feeling content even if they can't express it. Grief is another phenomenon that it affects all of us throughout our lives, especially for older people who often will have a dementia. They are suffering from grief and loss, but they are unable to either talk about it or even get in touch with their own feelings to be able to communicate that to you. Any sudden change in behavior can indicate a physical health change, unrelated to the dementia or related to the dementia, and it may require medical assessment.
Hello, my name is Veronica Nauman-Bugle, and I'm a Community Outreach Coordinator for the Alzheimer's Association. Environment is an important, yet adaptable, influence on behavior. It is flexible and changeable to suit the needs of a person with dementia. It is also often a challenge for those that need to be very creative to devise an approach and an appropriate environment with stimulating and calming elements. Stimulating elements such as music, the smell of fresh coffee, and activities and communication and people talking enhance a person with dementia's independence and quality of life. An active mind and body can foster a good night's sleep and also reduce restless behavior. Calming elements such as soft music and hand massages or neck massages are also necessary to allow a person with dementia's mind and body to rest and gather energy, because persons with dementia have a lower stress threshold. And people with dementia cannot comprehend and they can't make sense out of many noises at one time. So as a result, they often become more agitated when around many noises. So a mixture of sensory stimulating and sensory calming may help when we're dealing with unwanted behaviors. We also have a way of reducing environmental stressors, and one way to do that is eliminate caffeine from a person with dementia's diet. We can also reduce unneeded noises and extra people in a room, and this is particularly true when a person with dementia must focus on a specific task, if they're trying to complete tying their shoes or buttoning their blouse. Other things to consider are to create a safe environment. We're always looking at identifying, put locks on doors and disguise hazardous areas. And the doors would be an exit from a facility, as well as perhaps a janitor's closet in the hallway that holds chemicals. And a way to do that is not only by locking those doors, but you could also disguise them. Instead of it being an exit, it could be anything else. It could be disguised as a bookcase. It could have, you could use your imagination and use material or colored paper to create a number of different visual effects for the person with dementia. Anything but what in fact that door is. Contrasting colors are also very helpful for a person with dementia due to the fact that visual spatial deficits begin to exhibit as the disease progresses. For example, if you have a white tablecloth, a white plate with mashed potatoes on it, it is, even for us, very difficult to see that it is food and that it's something appetizing for us to eat. Also, using simple signs that can aid with cueing, and this can also reduce wandering. Very often when a person wanders, they may be looking for the restroom. So if you have a restroom area, you could place a picture of a toilet and perhaps the word toilet on the door, which will then help that person find the restroom on their own. And this is also important for them to do independent wayfinding. They don't need assistance from someone to help them find that restroom. Personal items should be prominently displayed to help with wayfinding. For example, if a person is looking for their room, which happens very often at facilities when rooms they look very similar. Each opening is the same and they're on the same hall. Very often people will have shadow boxes on the outside of their rooms with familiar items such as pictures of themselves so they can identify that this is their room, or familiar items, personal items that they cherish that they and only they can recognize. They will then in their minds know that this is the room where they belong. Reducing glare on surfaces, especially floors, is also very important. If you can't see where you're going and you are also confused and disoriented, it is a safety condition as well. Familiar odors such as coffee brewing can enhance appetite, and it can also foster independent wayfinding. If coffee is brewing and there's a smell of cinnamon toast, for example, that could signal to a great many people that it is breakfast time as opposed to dinner time. If someone can accomplish something on their own, they feel successful, they are happy, and this reduces their stress.
So, how do we get to the bottom of these behaviors? How are we going to become a successful caregiver in the face of all these challenges? Well, first of all, we have to center ourselves, and I often think of this as being a disciple of Sherlock Holmes. We have to look at this as a puzzle. We have to think about how we can become a detective and get the facts we need to care for our patients. We have to become very clear about what the behavior is and how we can deal with it. So the first thing we need to do is stop and question the behavior when it's observed. Look for clues about what is going on and why. And when we take a look at the clues around the person, but also look at the clues in the environment in which the person is functioning. And look for clues on yourself. Because sometimes persons with dementia react to us, even though we may care for them every day, in a way that indicates they have forgotten or misplaced who we are. Constant reassurance is very necessary in working with patients with dementia. Listen and talk to others who work with these individuals and other persons with dementia or other residents or patients, because they may be able to give you clues about the behavior. Look at each problem as a separate challenge. Sometimes behavior can be so overwhelming that we forget that we must look at each separately if we're going to devise an approach for each behavior. First of all, ask, is it safe? Secondly, and probably in combination with safety, is it dangerous to this person or to anyone else in the environment? Is this behavior realistic? Sometimes behavior which appears unrealistic to us is realistic to a person with dementia because their reality is not our reality. And so therefore we have to accept the reality as they perceive it rather than seeing it the way we see it. And how often does this behavior occur? Is this every day? Is it every week, every month? Is it 10 times a day? How serious is it? And how much attention should we pay to it? Just to give you some examples of internal and external causes of behavior. Here are a few internal causes of behavior. Pain is a very, very common situation with persons with dementia. And one of the ways they may respond to that pain is by withdrawing. They may withdraw from you into a corner. They may sit in a huddle. They may even go into something like a fetal position when they're feeling in pain. Fear is an overwhelming emotion in people with dementia, and I cannot say enough about how often this is at the heart of dementia. You may see people exhibiting tearful behavior. Again, withdrawal can also be a symptom of fear. Obviously, running away or hiding, those are all symptoms of being fearful. Frustration is a very, very common emotion because these people are losing touch with everything. It is often said, and I believe that I have seen some books that have been written on the subject, and the authors have talked about losing themselves. When a person has dementia, they are losing everything. And the amount of frustration that is experienced is something that I cannot even imagine. When people are frustrated, often they become aggressive. So aggression can be a response to an internal emotion of frustration. But there are also external causes, and here are just a few to think about. Temperature in an environment can cause a reaction. Sometimes we see people removing their clothing. This seems bizarre and very puzzling to us, but probably the simplest explanation is that the room is just too warm for these people. And instead of saying, could you turn the thermostat down or open the window, they are removing their clothing. This is the only way they have to express the fact that they're too warm. One of the other external causes of behavior may be the people who are surrounding the person with dementia. One example that I can think of, which is very common, is a group of people in a dining room situation or in a situation in activities where an individual person who may have been fine yesterday, today shows up for an activity or a meal, and your patient or your person suffering from dementia may react in a very aggressive or scared way, even though they may have tolerated this person very easily on Monday. On Tuesday, they will, because of their dementia, become aggressive and find this person very threatening. Also, of course, time of the day is very, very important. And we often talk about sundowning and other phenomena that are related to persons with dementia. It is very true that late in the day, late in the afternoon, and early evening, we do experience the wandering and pacing that is characteristic of what we call sundowning. In approaching any of these behaviors, regardless of what the cause may be, it's most important to remember that we're not in charge of the patient's behavior. And, ironically enough, they're not in charge of it either. So the only thing that we can be in charge of is our reaction and our approach to their behavior. Here are some helpful hints. And it is always very important to remember that no one individual can ever manage this enormous challenge on their own. Teamwork is essential. If you've known one person with dementia, and this is a wonderful quote, which I enjoy, then you've known one person with dementia. Everyone who suffers from dementia is first and foremost an individual. They have lived a long life, they have accomplished many things, they have likes and dislikes, families, pets, hobbies, everything that you and I have. When they develop a dementia, that does not change. What changes about them is their ability to communicate who they are to you. And so that is why you must anticipate and adjust your reaction to them and your approach to them accordingly. Relate to the person with the disease, not to the disease with the person. This is probably a good rule whenever we're working with any individuals, but it's particularly true with those with dementia. Keep a log and keep it very conscientiously. Write down the date and the time and the environment surrounding the behavior you're trying to track. Anticipate and adjust your routine and their routine according to what you've discovered in your Sherlock journal, which you are now keeping. Make a plan for dealing with this behavior, but make a backup plan. Because one thing we know about those with dementia is that they are changeable. Not only every day, they can change from 1 minute to the next and from morning to evening. So what worked perfectly well this morning may be a total failure this afternoon. Have a bag of tricks. Some very successful caregivers actually carry objects with them as well as ideas in their heads which they can use to distract or entertain persons with dementia and help them to be able to perform personal care or to help the patient to get through the day more successfully. Be creative. One of the most important skills that you as a caregiver will develop is the ability to change and the ability to think up new approaches every day for working with these individuals. Know that every caregiver needs respite or a break. And you will also need to take a break at times. Don't be afraid to ask for time to take a break, and don't be afraid to ask for help. Teamwork is essential for successful care of these patients. Also, don't be afraid to say at some point in time, particularly if behavior is aggressive and threatening, that you need help and you need to be rescued from this situation. You need to call on your colleagues and your supervisors and others to help you to be able to maintain your control and help you to help the patient maintain their equilibrium in this situation. It's very important to document problems over time. This gives not only yourself but everyone else with whom you are working a picture, almost a snapshot of what is happening with that particular individual. It also provides clues to the common behaviors that we see in patients with dementia. You can be Sherlock Holmes, and you can remember to record this information in the chart, to report it to your nurse and your supervisors as well as your team members. And it also is important to let other people know of the strategies that have worked for you. And they may not always be successful strategies. Sometimes you will need to let them know about approaches that you have used which have not been successful. We all learn from our mistakes, but also we learn from other people's mistakes. In working with patients with dementia, keeping a document, keeping track of the behavior, sharing it with others is critical to success. Now we come to talking about communication techniques. And this is the heart of the matter in working with persons with dementia. In a typical communication, we have a two-way street. Oftentimes, when communicating with persons with dementia, it is not a two-way street. Most of the effort and much of the thought that goes into the communication will have to come from you. There's a nice acronym called KISS. Keep it short and simple. This is a very good rule to use when you are working with persons with dementia who have impaired brain functions. Your approach matters. You don't want to argue with or get into discussions with persons who are confused. You want to keep it short and simple, and you want to use cues, both visual and actual cues that you will act out that the patient can observe. Many times people are not able to understand communication simply because of poor vision, poor eyesight, poor hearing. There may be distractions surrounding them that are taking their attention away from you. You may need to find some way to get them back on cue, back on target with what you're attempting to communicate. When you do establish communication, having reduced every type of distraction and external noise, then you will want to focus very carefully with the patient to make sure that they are understanding you. You're going to have to test to see if they do indeed understand what you're saying. You want to remember once again not to overload the patient. Listen carefully, provide reassurance, don't rush, take your time. It's worth taking your time because the desired result can only be achieved when the patient feels safe and comfortable, and also when they are able to understand as best they can what you're trying to communicate. A couple examples will perhaps help to see the difference between a positive and a negative feedback situation. Many times a person with dementia will wander into someone else's room or some other part of the facility. Our immediate human reaction is, no, that's not your room, don't go in there. And the immediate reaction of most persons with dementia is to become angry, more confused, even combative, and this does not help the situation. The more positive approach to that situation would be to say something like, you know, your own room is so much prettier. Why don't we go and take a look at that? This distracts the patient, puts them in a positive mode, reassures them, and accomplishes your goal, which is to get that patient to leave someone else's room. It's important also when we talk about communication and behavior strategies to use the technique called mirroring or modeling what we want the patient to do. And that is as simple as trying to demonstrate in every way possible what it is that you would like the person to be accomplishing, and to mirror their accomplishments for them as we go along. Always remember when you're approaching a patient to simplify every task and break it down into steps as much as possible. You want to be sure they understand who you are and what you're doing here in their situation. Maintain eye contact. Try to be at their level so they can both see and hear you. Show some humor. Take some time to make a joke. Take some time to make the patient feel reassured. Also, always show respect for the person with dementia. Even though they do have brain impairment, we must always remember that they must be treated with dignity, and they will sense when they are not. Respect their culture, because people from various cultures have various ways to approach tours, most especially in the area of personal grooming or personal care. Here is an example of what you can do in order to break down the tasks. If you're trying to get a patient prepared to get up and get dressed, lay out their clothing for them. You can give them some choices, but not overwhelming numbers. 2 choices on each article of clothing are probably the maximum you'll want, and you want to try to put them out in such an order that they can follow it for themselves. The goal here is to allow the patient to be as independent and self-directed as possible at all times. They feel more successful, and you have less work to do. At mealtime, you can simplify the task for the patient by arranging the place setting and making sure that they can distinguish one food from another and can simply and easily get to their food and enjoy the various items that are presented. Also, in the area of activities, it's important to provide meaningful and fun activities such as music and art therapy for the patients, and it's also important to remember that when you build on music and art therapy and reminiscence therapy, you're approaching the long-term memory, which is often very much intact with these patients. Prayers and songs and pictures from the past evoke good, strong, reassuring memories for these patients. They make activities enjoyable for them, and you will also find that you're enjoying activity time yourself.
Our goal is to maintain independence and to provide and create win-win situations, and they all give us the opportunity to maintain dignity. Since we know that we can't win an argument, and we also know that we have to adapt to the person with dementia's needs, validation therapy allows us to be in their reality because they cannot be in our reality. Here are some key points to understanding validation. Validation accepts people where they are. And of course, we really don't have another alternative. Since they can't be where we are, it is easiest for us to be in their reality. Validation helps them reach their goals, not ours. It is their goals that are important. We're trying to create win-win situations between ourselves as caregivers and the person with dementia. Validation builds self-esteem, it builds dignity and respect. Imagine being told you're wrong or that's not right, you're doing it wrong, and constantly being corrected. That certainly doesn't do a lot for a person's self-esteem, and nor do you feel very respected. So a way that we can provide respect and provide self-esteem for a person to remain independent is by using validation. And how do we do that? We listen with empathy. We really listen to what someone is saying. We acknowledge their feelings. Sometimes all we need to do is let them talk and let them know that we hear what they're saying. Touch is a very important and very powerful tool that we can use. Sometimes people use this when there is an unwanted behavior, and simply touching or squeezing someone's hand, letting them know that someone is there who cares and that they're not alone will reduce that unwanted behavior. Using who, what, when, where, and how in your questions when talking to a person with dementia will also help. Going to why is really not a good idea because it's very difficult for people to formulate those sentences and explain why something has happened. Reviewing the past, using reminiscence, anything based on long-term memories will be very helpful in using validation. Using song and dance, poetry, learned prayers from the past is very good in validation. In conclusion, watching your attitude, your tone, and your demeanor is something that we can all do to work out a win-win situation when dealing with persons with dementia. I think Plato had it right when he said, good actions give strength to ourselves, and inspire good actions in others. And this is particularly true when dealing with persons with dementia. Don't argue because no one's going to win. Actions speak louder than words. Have humor. Try not to take offense personally, and remember that it's brain damage. It's not this person communicating this directly to you. Touch and soothing tone is important and very easy to help persons with dementia feel safe. Ask for help because we all have our limits. And remember, you're not alone and your efforts do not go unnoticed. Enjoy being creative and flexible when working with persons with dementia because the rewards far outweigh the challenges.